What are wisdom teeth?
Wisdom teeth are the last teeth which are there in the jaw. This is the third molar. You can have the lower wisdom teeth as well as the upper wisdom teeth, which many a times when they are about to erupt at the age of 18 onwards, it can get what's called as impacted. What tends to happen is our jaw sizes are dependent on basically the growth which occurs because of the use and disuse of an organ. Now, the fact is, a lot of us do not use our jaws to what it is designed for. The food which we eat is basically very much processed food. Raw foods are not used. And this is not a problem just for this generation, but it is over the years together. You can blame it on genetics, wherein the jaw sizes are becoming smaller and smaller. And unfortunately, the last teeth to erupt in the mouth is the wisdom teeth. And these wisdom teeth get stuck in the jaw, and these are called as impacted wisdom teeth. So many a times we may have to take these wisdom teeth out.
Should everybody undergo wisdom tooth surgery?
Not necessarily. I mean, many a times, even though wisdom teeth haven't erupted, they are just lying passively in the jaws. What we tend to do is we do a simple X-ray, which is called as panoramic X-ray or an orthopantomogram X-ray, which gives the entire perspective of all your teeth and the jaws. And when we have a look at it, if by any chance the wisdom tooth, which is the last molar, the third molar, is basically having a slit or a gap between the second molar and the third molar, where food goes in and gets stuck in there. In such circumstances, many a times you tend to get what is called as an infection of the gum in that area, which is called as pericornitis. Now, in such kind of situations, we may have to take out the wisdom tooth. Or if the neighboring tooth, that's the second molar, if that is getting decayed, then we may have to think in terms of taking out the wisdom tooth and then address the second molar also by doing either a filling or, if necessary, even a root canal treatment for the second molar. Occasionally or very rarely, you may have certain pathologies which are associated with the wisdom tooth. And one of the most common pathologies is the covering on the wisdom tooth, which is called as the dental follicle, many a times tends to multiply and forms what is called as a cyst. A cyst is a bag of skin with fluid in it, and this tends to basically becoming bigger and bigger, and that can actually erode away the bone. In such circumstances, we may have to take out your wisdom tooth along with the pathology that's a cyst. And very rarely people can have atypical facial pain, or the forces which basically allow the wisdom tooth to come through can actually cause some pain in the jaw. And in such cases, when people do have pain, then you may have to undergo wisdom tooth surgery. But by and large, only when symptoms are there, we generally take out wisdom teeth. Otherwise, if the wisdom teeth are not giving any major problems, you can just leave it like that.
How is wisdom tooth surgery performed?
How do we do wisdom teeth surgery? By and large, most of the times wisdom teeth surgery is done under simple local anesthesia. That means that we give a tiny jab inside the mouth, and once it is the whole jaw is completely numb, then we can do it. Occasionally we may give sedation. It could be an oral sedation, and tablets such as diazepam, which is Compose, or Restil, which we would give the previous day and just before the procedure. We can also do that. Rarely we would also use what is called as intravenous sedation. That means that into the veins we give an injection that will actually calm you down, and then probably you won't even know that you're undergoing a wisdom tooth surgery. And extremely rarely we might actually take you into a hospital and do the procedure under general anesthesia. That means that you're completely knocked out, and then you can take out all 4 wisdom teeth. So wisdom teeth surgery can be done majority of the times under local anesthesia. That means that a small injection. Very rarely we also use a sedation, which could be an oral or an intravenous sedation, or under general anesthesia.
What are the complications of wisdom tooth surgery?
What are the common complications which can happen following wisdom tooth surgery? Yes, you will have a bit of pain, a bit of soreness. That usually lasts for a couple of days. Similarly, you will have a bit of swelling. That also is a reactionary kind of swelling which comes because of the surgical procedure itself. That usually lasts for a day or two, and then it gradually comes down in about 3 or 4 days' time. Long term, what can happen with the wisdom teeth? There are 2 nerves which are very closely associated with the wisdom tooth. One of them, which is called as the inferior alveolar nerve, runs in a canal just below the wisdom tooth, and that basically supplies sensation to your bottom lip and chin in this area. Now, when we are trying to remove the wisdom tooth because of the close proximity of the root to the nerve, this root can compress on the nerve, and when that happens, you can have a transient. That means that for a short period of time, which could last anywhere between 3 to 6 months time, you might have some numbness in the lip and chin region. Generally, this recovers over a period of time. The other nerve which is very closely associated is on the inner aspect. That is what is called as the lingual nerve. And this nerve basically supplies sensation to the tongue. So when we try to reflect the gums and try to protect the nerve, many a times that can actually traumatize the nerve, and that can actually cause a bit of numbness on the tongue. Both these two situations usually is only transient. That means that it's only temporary. This lasts for a few months, and then the sensation normally comes back. Extremely rarely, when we see that these nerves are in very, very close proximity, or if it has been compressed very much, you might have almost a permanent numbness in that area. But that is so rare, it could be like 1 in 1,000 is what we are talking about. So it's an extremely rare complications. But other than that, generally wisdom tooth surgery is a very, very safe procedure. In people who have very thin bones, or when the wisdom tooth is very deeply seated, very rarely we have also come across where the jaw can fracture when a wisdom tooth is attempted to take it out, but it is an extremely rare scenario. It could be 1 in 10,000 or 1 in 100,000. That's the rarity on that. But other than that, most of the times wisdom tooth surgery is usually not a major issue.